Being pregnant can be a joyous and exciting time in a woman's life. Hearing your baby's heartbeat for the first time, picking out their name, designing the nursery, and even planning their future. It can also be very nerve-wracking. You want nothing more than to protect this new life you are creating.
I'm a mother to two girls. Ariana is 11 years old and Victoria is 10 years old. Over the past couple of years, I've been kind of yearning to try again for possibly a little boy. When I found out I was pregnant, I was a little nervous because I'm a little bit older because I'm over 35, but I felt really positive about this pregnancy. At the 9-week appointment, Dr. Cohen showed me the baby's heartbeat, so I was really excited about that. The same week, I began spotting. The spotting started for about a day. It started to increase in intensity. I called Dr. Cohen's office and they told me to come in and they'll do an ultrasound courtesy to make sure that everything was okay. The ultrasound technician, I was asking her questions and she didn't want to answer any of the questions. She was telling me that I need to talk to the doctor. So they put me in the waiting room and I waited and I started really getting nervous about everything. And on my way back into the room, I saw my chart on the door and there was a little sticky note on it. And the sticky note said, "She doesn't know yet." I immediately kind of already knew what was gonna happen and that they were gonna tell me that I miscarried. And at that point, I had a lot of emotions. I didn't know what to think, but I knew whatever it was the doctor was gonna tell me, it couldn't have been good.
Early pregnancy loss, or EPL, can be heartbreaking and can affect a woman not only emotionally, but physically as well. After finding out that she had miscarried, Carlin was given 3 options. Watch and wait, which allows the miscarriage to happen on its own. Take medication, which allows the miscarriage to happen sooner. Or have a D&C performed, which allows the doctor to remove the pregnancy.
After being given the 3 choices, I wasn't sure what I wanted to do, so I told the doctor that I was gonna go home and do some research to figure out which option would work best for me. I didn't understand why this happened or how something like this could happen. I asked the doctor, and the doctor informed me that these things can happen and that miscarriage, especially in the first trimester, is common.
Pregnancy loss is defined as loss during the first 13 weeks of pregnancy. It can be either intentional or unintentional. There are many causes of unintentional early pregnancy loss. Around 50% of the time it's due to chromosomal, whether it be microdeletions, deletions, or an unexplained chromosomal anomaly that may occur. There's maternal indications, whether there is hormonal infection or there's an underlying autoimmune disorder within the patient. And also we have our alcohol abuse, drug abuse, excessive caffeine intake, smoking, malnutrition, improper or abnormal implantation of the fetus, and also advanced maternal age.
Before I could make a decision, my body kind of made that decision for me. After a few days, I started to bleed very heavily and I was passing clots and I was in a lot of pain. The cramping and the bleeding was so severe. In the middle of the night, I felt a very full feeling, like a lot of pressure, and I ran to the bathroom. Stepped inside of the bathtub, and all of the blood just started coming out.
Some of the physical effects that are associated with early pregnancy loss include moderate to severe cramping, bleeding, rarely fever. A patient may continue to bleed within 48 hours or 72 hours after a loss. If a patient continues to bleed where she's going through, as I tell them, a pad an hour, it is important that they seek care either by their healthcare professional or to an emergency room. It's important to educate your patients and to let them know if the bleeding persists and it's hard for them to even get up and walk to the bathroom because of dizziness or they feel like they're going to faint. These are signs and symptoms that the patients may be having an increased amount of blood loss and they need care immediately. In our office, all our patients, when they come in with suspected or with early pregnancy loss, a hemoglobin is checked in our office. That tells us pretty much how much the patient has been bleeding or how much blood they've lost during this type of miscarriage. Now, why is that so important? Because we really don't want to send a patient home if her hemoglobin's low with the risk of possibly needing a blood transfusion or passing out while they're driving home or having an accident at home. It will also dictate our management at that time, whether we need to do something immediately, whether it be in the office or in the hospital, such as a D&C, Or if the patient's blood volume is stable, we could send them home with medication.
Dr. Cohen then asked me to come in for ultrasound. I was informed that I still had some tissue remaining, so then I was again given the same choice as to whether or not I wanted to take medication to help with passing the tissue, or if I wanted to have a DNC procedure completed to have the tissue removed. I decided to go with the medication. He prescribed me a tablet called Methergin. The Methergin tablet helped to slow down the bleeding, and it also helped me to expel some of the tissue that I still had left inside of me. But in the end, I still ended up having to get a DNC procedure.
Bleeding due to early pregnancy loss, or EPL, warrants expectant management to avoid complications. Methergin, a uterotonic, along with another medication, misoprostol, is commonly used for early pregnancy loss hemorrhage. Methergin tablets have a rapid onset of 5 to 10 minutes, is an appropriate first-line agent to manage early pregnancy loss hemorrhage.
I was really excited about being a mom again. My girls wanted another little sister, but I really wanted a little boy of my own. But I will never know whether I was having a boy or a girl.
One of the toughest things our patients will deal with is early pregnancy loss. Whether it be in the first trimester or the last trimester, a loss is a loss, and it's to be dealt with that on an emotional level. It is up to us to help our patients get through these tough times, not only physically, but also mentally.
And even if you do go through something as terrible as a miscarriage as what I went through, if you want a baby, definitely go after your dream, go after what you want, because in the end, what you will gain is far more than what you lost.
For more information on EPL, you can visit Methergin.com or just log on to accesshealth.tv. What is Methergin used for? Methergin is used just after a baby is born to help deliver the placenta, also called the afterbirth. It is also used to help control bleeding and to improve muscle tone in the uterus after childbirth. Who should not take Methergin? If you suffer from hypertension, high blood pressure. If you experienced one of the common complications of pregnancy called toxemia, sharp rise in blood pressure, leakage of large amounts of the protein albumin into the urine, and swelling of the hands, feet, and face. If you are pregnant. If you are allergic to Methergin. How should I take Methergin? 1 tablet 3 or 4 times daily for a maximum of 1 week. What should I avoid while taking Methergin? Grapefruit and grapefruit juice may interact with Methergin and lead to unwanted side effects. Discuss the use of grapefruit products with your healthcare provider. What warnings should I know about Methergin? Do not breastfeed within 12 hours after taking Methergin. Methergin may pass into breast milk in small amounts and could affect a nursing baby. In some cases, you will need to use this medication for up to 1 week after your baby is born. You may need to use a breast pump to establish and maintain your milk flow until your treatment is finished. If you use a breast pump during this time, throw out any milk you collect. Inform your doctor if you have kidney or liver problems, since these conditions can adversely affect Methergin activity. If you have a heart disease, coronary artery disease, smoke, are obese, have diabetes, or high cholesterol, you may be at a higher risk for Methergin to cause narrowing of the arteries, which may lead to a heart attack. What other medications might interact with Methergin? There are a number of drugs affected by or will affect the way Methergin works. Tell your doctor about all medicines you use, including prescription, over-the-counter, vitamins, and herbal products. What are the possible side effects of Methergin? The most common side effect is high blood pressure associated with seizure and/or headache. Other possible side effects include low blood pressure, stomach pain caused by uterine cramps, nausea, and vomiting. Tell your doctor if any of these symptoms are severe or do not go away. Call your doctor immediately if you experience seizures, chest pain or discomfort, slow or fast heartbeat, difficulty breathing, dizziness, swelling of the foot or leg, skin rash, swelling of the eyelids or around the eyes, face, lips, or tongue. These are not all possible side effects of Methergin, and others may occur. If you notice other effects not listed above, contact your doctor or pharmacist. You may report side effects to the FDA at www.fda.gov/MedWatch or call 1-800-FDA-1088 or contact Lupin Pharmaceuticals, Inc. at 1-800-399-2561. For more complete information about Methergin and your specific health needs, talk with your doctor or pharmacist. FDA-approved labeling can be found at www.methergin.com.